And this change is shifting the landscape on how to handle the new pandemic surge.
KXAN's Maggie Glenn listened in to the State Department of Health's first update in weeks, including treatment options for this wave.
Health authorities statewide sound the alarm as the Delta variant is on track to break previous COVID peaks.
We're seeing steep increases in hospitalizations, steeper than we saw at the same point of even the first wave or the second wave.
But Texans were just getting used to pre-pandemic life.
We sort of get criticized because one day we say this and a few months later we say that, but we're trying to keep up with the current changes in the way the virus is acting.
In Lubbock, the Public Health Authority pleaded with residents to mask up again.
It concerns us enough that we need to say it is best to mask, especially if you're going to be indoors.
DSHS says those changes follow the evolving nature of the virus.
Our guidance will change because we are trying our hardest to base it on science and facts and make sure that we are using the most recent, strongest data that we can.
There have also been changes in treatment, like remdesivir, which initially showed promise in reducing the amount of time severe COVID patients spent in the hospital.
Meta-analysis got released recently, I think of 7,000 plus patients, and basically showed that remdesivir doesn't really do anything.
The one constant that remains, the vaccine is the best way out of the pandemic.
We will take care of you if you become ill. However, it is our belief that your best option is to stay out of the hospital by getting a vaccine and wearing a mask.
Maggie Glenn at KXAN News.
DSHS says it's working with local communities to ensure enough testing is widely available as this surge continues, and says testing supplies are not of concern right now.
Austin Public Health warns the Delta variant has a much higher transmission rate. Putting it into perspective for you, here's an estimate from APH on what we need to do to reach herd immunity. To combat the Delta variant, we need nearly 89% of the population vaccinated. That's actually more than the amount needed to stop whooping cough. Compare that to the seasonal flu, where less than a quarter of the population needs a vaccine to protect all of us.
The mutation increased the number of viruses that are being produced in the human cells when somebody gets infected.